Now we're going to begin the first session of the day. It's a serious topic. With tissue engineering, organ bioprinting, and regenerative medicine no longer remaining a distant stream, it's important to discuss the far-reaching implications of seamlessly focusing technology with healthcare delivery modes and services. To shed the light on this topic, we have Mr. Brian Cho, Director of Business Development, ROKIT Healthcare, who will speak about the subject of Total Regeneration Platform. Ladies and gentlemen, a big round of applause.
Hi, good morning. I am the one who is introduced by the organizer, and I am from the South Korea, and I am the director of the sales part, which is the business development of ROKIT Healthcare. It works. Okay, thank you. First of all, thank you for having me here so far, place from South Korea, but as a sales representative of the Middle East, I am really pleased to be here and share our solution, which is a very sophisticated technology, is aligning with the 3D bioprinting-based organ regeneration platform. Recent few months, we secure very positive and promising results from our clinical trials from around the world, and we are expanding our market to the entire world, including Middle East, of course, and the majority of countries in European countries and the United States, including many states. And our solutions is to save the people on this entire planet. I'm really expecting the result and your responses right now. So I'm gonna get straight right now. ROKIT Healthcare is not just the 3D bioprinter manufacturer. We are providing with the total healthcare services, including organ regeneration platform. Our mission is actually, the ROKIT Healthcare defines aging is disease. So our basic concept is to cure the aging. Aging is disease. That's our thoughts. And recent trend of aging research is defining the aging is disease. So if we can cure aging, we can cure all kinds of disease. That is the recent concept. Our company not just originally established as a healthcare company. We established as a 3D printer company with the FDM printer or SLS printers. But now we are changing into our mission to healthcare providing company. That was started from the last year. So we changed our name, ROKIT, to ROKIT Healthcare. So now we are here. And after a year, we have been doing many clinical trials, including skin and the cartilage itself, and the hair regeneration, of course. And our further mission is heart regeneration and kidney and the retina regeneration. This is our final landscape of a regeneration platform. Our first mission, as I said, is the aging is disease, and the nature is the best description for the curing disease. And as you see here, our first application is skin regeneration. We also have very clear optical results for the curing the chronic wound, including diabetic foot ulcer and pressure sore and other kinds of chronic wounds. Of course, we can regenerate the scars, and after grafting the normal scars after wound contraction. And our next application mission is the Cartilage Regeneration, and we are conducting human animal clinical trial in United States with 20 beagles, and now we are proceeding to the human clinical trial next year, April, or if it's getting earlier, maybe March or February. So we are really expecting to. And our further mission is to regenerate heart and retina, kidney, as I said. And this all total organ regeneration platform established by ROKIT Healthcare is our core mission. So for that, our leaderships are working together from around the world and around many kinds of fields. In terms of my career, I used to work at an IT company, foreign IT company. I was a sales representative of data storage and servers. So I changed my career into the healthcare field because I felt it was very helpful and really good field for saving people, not just like an IT field. But IT, of course, to make people convenient, but that's just not unlike the healthcare services. So we are coming from the various fields, including the insurance and the automobile and IT. So I call the ROKIT Healthcare is a furnace of idea. And this is what we do right now. We have 6 categories as a current, just right now project, I call it. And on the right side of this circle, we call it the organ regeneration platform and its composition. As a hardware, Dr. In Vivo 4D and Dr. In Vivo 46, these are the hardware for the organ regeneration. And we call it we just don't call it the 3D bioprinter. We just call it the organ regenerator, 4D biofabricating technology based. And the bioinks are very essential. These is including hydrogels like collagen and gelatins and the arginate as well. And this is biocompatible and biodegradable hydrogels and biomaterials. And for combining all those things, so we can realize a real organ regeneration platform. As I said, skin and cartilage regeneration platform is about to launch in the next early year. And our hair regeneration platform is consisted of the consumables like treatment and shampoo and hair boosters. And we got the optical result, informal optical result, but we are about to release it to the world with the launching this platform. And those are the genomics project being conducted by the ROKIT Genomics, which is our subsidiaries of ROKIT Healthcare. So I'm not gonna introduce this more detailedly here. So what is biofabrication and why is this so important? I'm gonna give you that. This is our image of the organ regenerator, Dr. In Vivo 4D. Dr. In Vivo means, Dr. Kim or Dr. Park or Dr. David and this kind of thing. And the 4D means 4-dimensional. The reason why the biofabricating is important is our tissue and our organ and even entire our body is 3-dimensional, right? So we have to print it out. We have to culture cells in a 3-dimensional type. But so far, we have been doing the 2-dimensional cell culturing, but it has been working so well. But in the future, but we have actually extra technology, so we have to do that for the real dimensional drug testing or the tissue engineering. But that is not just the only thing that can realize a total organ regeneration platform. We have to converge almost all kinds of technology, like cell sheet technology and the human ECM, or we normally use autologous cells, but in terms of cartilage regeneration, we use allogenic cells, of course, but normally autologous cell, simply called we extract adipose tissue from the patients, and we do not extract it, we do not separate it, we just use it with the minimal manipulation. And as I said, biomaterials like bioink or biopolymers, including PCL or PLA or the arginate and hydrogels, are very important because the bioinks and the outcomes from this 3D bioprinter should be implanted into the human body directly. So it has not to have its toxicity and the other kinds of chemicals and the other things that we can imagine very harmfully. And here's the why 3D bioprinting is so important. This is another evidence. This is the 3T3 fibroblast from NIH. And as you see here, 3D printed cells and manually spreaded cells are almost the same on the first day. But after 6 to 7 days, you can see the many cells are dead within the manually spreaded Petri dish. The reason why it's happening is these cells are equally spreaded onto the tissue and then three-dimensional scaffolds. But in terms of a manual experiment, they are suffering from the necrosis and lack of ingredients. So because of that, many cells are dead. But now we have only this result in the normal laboratories, but these results are relatively good. But if you print it out the 3D bioprinter or organ regenerator, you can secure those kind of results. So better than this. And this is the first application that we have created about 6 months ago. This is dermatology solution. As I said, we can, we can regenerate the scar and chronic wound. But we firstly focusing on the chronic wound treatment. So the first application was the diabetic foot ulcer treatment, and we are trying to expanding its application into the pressure sore and venous sore, of course, and another kind of chronic wound. It could be completed by our solution. And this is the formation of skin regeneration. Basically, we use patients' adipose tissue, which means autologous cells. But normally, from the many articles from around the world, they extract SBF or adipose stem cells or mesenchymal stem cells as well to treat just only with the stem cells or their SBFs. But we do not do that. We just use the fat and its stem cells just itself. But we just fractionate it into the MAECM. MAECM is an abbreviation of minimally manipulated autologous extracellular matrix. We call it the film. But somebody say that this is a skin substitute. Yes, of course it is. But normally, whatever we call it, we just use a patient's adipose tissue. It's very meaningful because there's no immunoreaction. There's no any responses if we insert to the human body. So we are called the ROKIT Healthcare, which is carrying the organ regenerator or the 3D bioprinter with the human clinical trial test. This is the first case. And this is another example. This is for the bone regeneration. If somebody can walk very inappropriately, we can cut the bone and with the wedge type, and we can print it with the PCL and the hydroxyapatites and beta TCP. Those ingredients are very essential for the bone printing and bone regeneration. So we can do that very easily because the bone is very solid, right? So we can deal with it very easily. And this is the cartilage regeneration. This is the formation of the cartilage regeneration, and the same as the skin regeneration by using the human adipose tissue. And we mix it with allogenic costal cartilage powder. The costal cartilage is right here. Is normally have the 90% of the regenerative, the cytokines and growth factors. That is a well-known fact. So we choose the costal cartilage among the many cartilage within our body. So we have the license to import the costal cartilage from the United States, and we have a license, so we can do that. But we cannot make it fine powder type, so we should establish the center of excellence within the hospital or the clinic providers, and we call it the center of excellence of the cartilage regeneration platform. We can do it with some hardwares. I will show you in the next page. And this is retina regeneration and heart patch application as well. In case of this video, I cannot click it, but we can find that this is the cardiomyoblast and Hubeck cells are bunched up together, and we can find that this tissue is beating with no any external stimulus and electrical stimulus as well. It's maintaining about the 5 to 6 days. So we just focusing on, we got the successful result twice last year. So we are developing its model very sophisticatedly, and we will launch about next 2021 or the even later, but we are developing it. And the more detailedly, the skin regeneration platform is like this. This is the porcine, which means pig experiment of the wound treatment. We just print on the pig's skin directly, so we call it the direct skin printing. Of course, this is not just, we can do that right now because the direct screen printing, the technology is not so simple, and we have to calculate the height between the porcine skin and the extruder's tip. But this is the future type of the bioprinting for human body. But now we are thinking about the normal wound healing procedure. This is very, very well known for the doctors and even the researchers, right? Everybody understand that. But the blood vessels are a very important point for curing wound and the contraction procedure, of course, because it delivers the cytokines and growth factors to the wound site, right? But if the diabetes patients, in terms of diabetes patients or the metabolic disorder patients, they cannot deliver these health factors for the wound sites because of the blood flow is not so smooth. So the wound contraction procedure cannot be proceed. So all these helpful the cell types are not functioning. So the wound is going to be chronic, like this. So we call it or we can see the many chronic wound cases like the diabetic foot ulcer or pressure sore, of course, and there are so many chronic wound sites. So we are focusing on the Wagner wound classification. We can we can cure this grade from 1 to 3. We can cover all these the patients within this grade. So these patients are accounting for about 40% of this classification. So we are focusing on this chronic wound first, and then we are going to move to the scar regeneration as well. This is one of the researches of the wound contraction, wound cure, the helping technology, support technology. We are carrying this red one, 3D printed structure and nanofibers. Nanofiber means nanofats with the cytokines and the helpful factors. And this is the scientific background of our solution. First one is the SPF and the ADSC. And these technologies are not so new one. Is already known. So we just found just how to cure it with no any inflammatory reactions. So we just find the way of this kind of the protocol. We just assess the chronic wound size and its shape and depth. We just customized with the 3D scanner. And we just exchange into the STL file. STL file is generated from the CAD or the 3D modeling software, and then we can just print out with this software from our organ regenerator. And this output is 100% customized for the patients who is with their chronic wounds, so we can cover it up just at once, 100%, with no any defect, with no infection. Of course, as a business as usual, the patient's assessment and the wound assessment should be occur. This is the doctor's business and doctor's work, just like normal days. But right after that, the dressings and negative pressure wound treatment or the skin grafting are being conducted right now so far. But now we are changing these procedure into the customized therapy within conducting within just 30 minutes or 20 to 30 minutes within the operating room. So We got the EMA's approval before being the human clinical trial with this protocol. And there's the two conditions, which are the minimal manipulation. Minimal manipulation means physical manipulation, simply. We have not to add some chemicals, or we have not to culture it or reuse it, or those kind of things. And homologous use means we have to use it as the same purpose was the adipose tissues purpose, original purpose, the cushioning and the protecting the tissues and those kind of things. So under those two conditions and under this EMA's approval, we have the results of like this. This is the first our patients of the diabetic foot ulcer treated by our platform. This is a 65-year-old woman, and she has the chronic wound, the diabetic foot ulcer on the right sole. It's a 10-month-old chronic wound. And the reason why the black area, this is the sole, but the black area right here is because of skin grafting. She got treated about 11 to 12 months ago with the skin grafting with very high cost. But after 2 or 3 months, there is a recurrence here like this. So they cannot contract it, they cannot cure it. But after inserting our outcome from the organ regenerator, this wound completely cured just within 4 weeks. Here's another example, and this shape is totally different from the first one. And this is, you can see the white and yellow area, also pink area, because this is because of the vascular networking and all the cytokines, all the neighbor tissues are generated by its substitute. In the first case, you can see also the vascular networking within the skin substitute. This is a very sensational phenomenon because there is no blood vessels, and the very poor blood flow causes its chronic wound. But the situation is totally converged into the different way. So here's the more examples, and in case of these patients, it takes only 2 weeks, about 13 days, I guess, 13 to 12 days to 100% cure. Of course, it's depending on the patient's nutrition condition and their living circumstances and the wound size. Yes, there are so many variations, we know that, but we cannot assess it very detailedly just right now. We are working on it, but the thing is that the maximally just 5 weeks we need to cure this chronic wound 100%. That's the important thing. So we are developing our scientific background more sophisticated and more detailedly. And this is the result, the intermediate result. We use autologous nanofat. Sorry. This is the outcome from our organ regenerator. This is a skirt for the making the shape of each patient, the wound shape, and we print out to the nanofats like this. This outcome just for this wound site. So we have to cover it up 100% at once to prevent the infections and to prevent its defect. So we have to do that after wound preparation. So as a result, there is no immune rejection. Of course, this is from the patient's autologous cells, right? And no risk based on these facts. So we were very wondering that what is our difference and our competitive advantage comparing to others. I mean, the conventional way of treatment of this chronic wound. So we are comparing other way of treatment. Simply, you can see right here, quadrant. ROKIT skin, we just divide it into the two factors. The first one is the quality of life and the efficacy. Of course, we are 100% confident with our efficacy, but the thing is the quality of life and the cost. So we are adjusting our cost for the affordable solution, comparing to the skin grafting or the other kind of things. I have been told the negative pressure wound treatment is widely being used by hospitals and the healthcare providers, but I think we can beat it. We can dominate against the negative pressure wound treatment. But I don't think that is the 100% competitive. We can maybe make a package with the dressing and the ROKIT Healthcare's platform and the ROKIT Healthcare's platform and the skin grafting sometimes. Yeah, there are so many ideas. So now we are standing in the baby step. So we need much more idea from the people just like you. So that's the reason why I'm here. And this is the second application, cartilage regeneration. This one is our machine. We just call it the Dr. Matrix Factory. The first one is a rheophilizer to make it frozen, and the frozen bone meal to grind it for making the fine powder of the allogenic costal cartilage. The costal cartilage is going to be mixed with the human's adipose tissue. Now we do not have any human clinical trial result, but we have the animals. This is the formation that I already give you, but this is the result of a bigger experiment. The safranose stain result shows that the red area, you can see the red area, the upper one is the control, which means with no our solution, it's just the normally generated by its regeneration, the procedure, just by itself. But the beneath, this case is showing that the efficacy of our platform. And the safranose test shows the red area is generated by our the solution, and the collagen type 2 and type 1 region shows that. Okay, I cannot explain it very detailedly, but it shows that our solution is targeting to generate a hyaline cartilage. As you know, our body has three types of the cartilage: hyaline and the fibro and and the elastic cartilage. But hyaline cartilage is composed of over the 80% of our body. So we need the hyaline cartilage. As a result, we find that the almost the same area with the stained by the collagen type 2 indicates that the hyaline cartilage. So we are expanding its scale into the 20 beagles. In the United States, we already completed just about 10 days ago. So we are collecting the result, and we are just making the image like this with the highly scaled experiment. How about the human clinical trial test? Of course, we are gonna do a human clinical trial in Egypt next year, early next year. But within our career, I'm just discussing with one of my clients with the avascular necrosis. This is very, very serious problem for young people who are in their 30s or 40s. It's very common, more common in their ages. So it occurs their lives are disrupted, and there's no cure, available cure just so far. So we just try to. This is very similar mechanism with the skin. I mean, chronic wound, because of the avascular necrosis means this is the blood flow. Blood flow is getting worse. So because of that, the cartilage is degraded. So we wanted to test it, and we are preparing with this clients and to set up all the infrastructure to test it. So this is another example. All those things are based on the bioinks. Bioink is very important composition of the essential factor to realize this kind of platform. And this is the 4 basic conditions for making bioinks. The first one is, of course, biodegradable and biocompatible, and we should calculate the viscosity, and the gelation is correlated to pressure and its the cell viability directly. So we have to concern it over. As you said, the cell viability is the most important thing. That all these conditions are concerning for the cell viability. And this is another example. If we use, our goal is to add human decellularized ECM for directly implanting into the human body. But as you know, in our body, there are many organ types, and their ECMs are totally different from each other. We just produce the humatin, which is a human cell-derived ECM. So far, the researchers are using the material for making organoids derived from the cancer tissue of rats. So they can apply to the human clinical trial directly. But now we are inventing based on this concept to converge into the human clinical trial. But we are also producing the customized human ECM from the heart and the kidney and retina and of course derma and the Hubeck cells. So our basic concept is add into the hydrogel those kind of decellularized human ECM, and we want to use it directly to human clinical trial. So that is itself very meaningful for the human clinical trial test. But this is the concept of some researches. And this is the bioinks variation. The bioinks are simply sorted by the hydrogels, including collagens and gelatin. But this is not simply articulated for all the researchers from around the world. They use it with the mixture of another components and many things, right? So we cannot say it just only one word for all researchers. So we have to adjust it depending on their topic of research. As a final the presentation, this is our organ regeneration, organ regenerator hardware, Dr. In Vivo 4D. It realizes skin and cartilage and regeneration platform. We cannot think our platform without Dr. In Vivo 4D or 4D6. We designed this machine as a clean bench because we have to print out living cells within this the generator, right? So we have to maintain it sterilized 100%. So we equipped the H14 HEPA filter and the UV lamps simultaneously for gelation and the sterilization as well. And we also have the temperature controller with the accessory machine to control the bed and the syringe site for the printing out the bioinks. And this is a configuration. If you somewhat interested in this, I'm going to give you some much more information. And so I don't have to talk about all the details of things. The thing is we have 3 product lines, the standard, upgrade, and premium. Yeah, that's the thing. And we can print out the scaffold, the various types of scaffold. And this is the software. This is not a modeling software. This is just adjusting the parameters.
I'm so sorry to interrupt. Can you conclude for the time issues? As you know, we don't want to run out of time.
Okay. So, this is the conclusion. We are, as I said earlier in this presentation, we are not just the 3D bioprinter manufacturer company. We are a healthcare company providing with the organ regeneration platform, including skin and cartilage. So just unlike our competitors in terms of 3D bioprinter, we are focusing on the organ regenerating, not just the bioprinting. So that is what I want to give you today. And thank you for listening to me, and sorry for consuming the time much. Thank you.